Hey everyone, it's been quite a while since I've done a video with an update on Reece, so I thought I would take a little bit of time to catch you up so you know what's going on. Reece has been off of chemo for a year now. His tumor has remained stable throughout that year. There has been no growth. In his most recent MRI, the doctor said it may have shrunk a little bit. Hard to say because an MRI is kind of inaccurate in terms of how it pictures. They call it slices, and there's no way to get a duplicate slice every single time. So they do the best they can to align it. In all likelihood, it hasn't shrunk, but I like to think, ooh, it might have shrunk. So that means he can continue to go without chemo. He still has to have an MRI every 3 months. This will be what his life is until the tumor starts growing again. They're not going to slow down how often they see him, or at least that's the current plan. So a couple of things have happened that have left things a little uncertain, and the first one is his oncologist moved to Florida. We met his new oncologist this week, but he's only going to see her twice before we actually move to another state where we're going to have to meet a new oncology team. Now, the upside is that his previous oncologist already went to Chicago and talked to the people who would be treating Reece, so they already have his treatment plan, what Dr. Gorangan's preferences for Reece. So it's possible that nothing changes and we plod along as we're going now. But they have their own protocols there as well and a great team. So they may look at his tumor and say, hey, we have a better idea. It's just difficult to say. So a little bit of uncertainty there. Been a little difficult meeting a brand new oncologist, knowing we're only going to see her a couple of times and then having to move on again. And that's tough for Reece, who gets really nervous when he meets new doctors. He's afraid someone's going to say more surgery. So he acts, it's hard to say, he acts out a little bit. He gets real spazzy and talks back and doesn't answer questions and tunes out, and it gets difficult when he meets somebody new. On a previous video, I did say that he was diagnosed with a benign tumor, and that changed. If you're following me on Facebook, you know that it was the pathology. They were concerned about it when they did the biopsy. They were like, oh, benign, benign, but it was funny. And what happened is they continued to grow it in a lab, and in the lab, it grew into cancer. And Reece's tumor grew between the surgery and the start of chemo, which means that the tumor became a malignant tumor. So that didn't change anything. The same treatment plan is in place that was in place before, and his prognosis is still the same as it was before. They got so much of the tumor out, they could let it go, even if it started growing now. If it grew slowly, like they suspect it started growing when he was 4, and it was detected, it was a large tumor by the time he was 9, but still, that's 5 years. So if it grew at that same rate, he could still conceivably grow the tumor until he's 18 and not die from it. Not that we would want that to happen, but I'm just saying he's not in any danger right now. His paralysis mostly went away. He has now a numb feeling in the left side of his face that he doesn't have on the right side. And when they do these series of tests where they follow my fingers, hold your breath like this, and they try to poke the breath out, and they have him grin real big, and that's when you notice there's a still mild, very, very mild palsy in the left side of his face. It may never go away. They're not going to try to do anything about it. That's what happens when you start messing around with the brainstem. Sometimes you do damage, and it can be irreparable. Could be so much worse. So just nothing to fuss about. His vocal cord still is not recovered, so he still speaks in a higher than average 11-year-old voice. We're still hoping that when his vocal cords thicken through puberty, that it won't be noticeable. There are several procedures they can do to correct that problem. They could do shots, which they could do regularly once every couple of years, and that would just continue to keep his vocal cords functioning. And they can also do, there's like a stem cell placement that they can do, and then there's also surgery that they can do. All three of those options are open to Reece later, not right now. No one wants to force him into another surgery, and he doesn't want to go into another surgery. And he does have control over his voice, like he can force it to a lower tenor, a lower, like talk like this, if he wants to, but it is a conscious thing. It doesn't come naturally. School, so he had to repeat the 4th grade this year. He still missed some school, but not nearly what he did last year. He still has his MRIs and doctor's appointments, and so that still takes precedence, obviously, but he's doing well in school. His teachers like him. He is gregarious. He's gotten back to his old personality, which is great. He has gotten used to a lot of individual attention, and so the first few months of school was a little frustrating for all of us as we got used to being in a group setting again around a lot of kids. But he's doing well. He'll be going on to 5th grade next year. He is obviously disappointed that he had to repeat the 4th grade, but there was no way around it. He really only went maybe 10 days for the entire year, the year through chemo, because he was going weekly. He was sick far too much to go to school with any regularity. I have had some people ask me why they don't continue the chemo until the tumor is gone. So chemotherapy is poison, and Reece's body is growing. And when you poison things that are growing, they stop growing or they lose the ability to grow. And so they don't like doing chemo on kids. They usually only do it when it's life-threatening. And when Reece was going through chemo, his tumor was growing. Once it stabilized, they stopped doing the chemo. If it starts growing again, they will go back to old treatment options. He did have an allergic reaction to the chemo, the carboplatin. That was the chemo drug he was using. He had an allergic reaction to that on his last visit. He started breaking out in hives, and I talked to the nurse, and she said that's why they check them every time before they leave, because it's actually not uncommon for kids to start to build up a resistance or to develop an allergy to whatever chemo drug that they're getting. So that happened to him. He had to have a Benadryl treatment. It wasn't, he didn't start to, his throat didn't close up or anything, so no anaphylaxis or anything like that. But if he does have to start on therapy again, it will have to be something new. They will have to try something different. And what we're hoping for is his doctor, his oncologist, was part of one of the drug trials for injecting vaccines into the tumor sites and dissolving the tumors. This is still earlier phases. We're still several years away from, if the FDA actually ends up approving it, we're still several years away from that. But it would be great because Reece's tumor is in a position where that kind of treatment would be ideal. It's non-invasive. It's a needle in the area, and it could dissolve that tumor. And so that's kind of what we're praying for. It just remains stable, and then when that treatment becomes viable for the average person, that he could just have that treatment. We're hoping that that happens before he's 18, because his insurance has to change when he turns 19, and I don't want him to have to deal with finding an insurance to cover the treatment that he needs as an adult. That's going to be a frustrating thing. He has gained weight, which is great. Some people have noticed in a past photo he was all skin and bones, and he looked frail and sick and awful, and he doesn't look like that anymore. He is now 74 pounds. So when they ended the chemo, he was 50. And his lowest that he got was like 45 or so. And thinking about that, that's a 10-year-old boy. So he was really, really scrawny. And he's still small. He's small for his age. He's still in that 95th percentile in the low range, or the 5th percentile, whatever they call it. He's in the low range for his age group. He's still shorter than the other kids his age, but other things are growing, like his feet are my size. So he's definitely got some growing to do, and his brain tumor is not in a place that's going to inhibit his growth. So he still only eats a handful of foods. That's frustrating for us as parents, and most of it's junk food, and we're trying to figure out how to give him a well-balanced diet while not having him be disgusted with every meal that he eats. So that's a struggle at home. He recently started playing outside for hours at a time. It can take a long time for the chemo to leave the system, and the doctor said it depends on the kid. It could be anywhere from 3 months to a year. Well, for Reece, it was a year. And about just a few weeks ago, he started playing outside more, and now he's going where he's spending a long time outside, running around, playing with his friends. So it's a nice transition just for us, him not being inside all the time, and just for him to be healthy. He needs to be spending time outside. Reece has been suffering from migraines. It has been bad enough that he has missed some school. We talked to his oncologist first because our first instinct was that it was brain tumor related. So when he had his last, not this previous one, but the one before that, they went ahead and searched the entire brain to see if there was any other indication for the migraines. They just wanted to separate the tumor from his migraines, and there doesn't seem to be a connection between the two. The issue that he had before was swelling nerves behind his eyes. We're not sure if that's the cause. We've been asked to keep a headache diary so that we can track when that occurs, whether or not it's related to food he's eating, whether or not it's occurring on a rainy day, a hazy day, a high pollen day, those kind of things. So we have to track his migraines when he does get them. They usually last a couple of days. They usually keep him from sleeping. Everything bothers him. If you suffer from migraines, you know what it's like, because migraines are terrible. That is something we are tracking right now, not tumor related, like I said, but it could be related to his eyes and the pressure on his ocular nerves. It can take months to get into the eye doctor, the neuro-ophthalmologist. So since it's not life-threatening or even considered emergent, we have to wait, and we'll track his migraines and see where that takes us. I think that covers everything. If you have any questions, just let me know. I did try to get Reece to talk on video many different times about the cancer, about his treatment, how he was feeling, and he just didn't want to do it. He didn't want to bring more attention to himself. I don't know. I'm not sure what his reasoning were. He just because. But, you know, there's an underlying reason, because any other time he'd be happy to be on video. So if you have any questions you want to ask him, I can ask him on your behalf. But he's doing well, and we are so thankful. God bless, and thank you everyone for your prayers. We love you all. Bye.